Number 2, on what must characterize your exercises for them to really work. Number 2 is that they must be moderate. Of course, it has to be one that your body can bear. This depends on your age group and your persons, your endurance level. I'm not expecting a 60-year-old man, for instance, to start running in the name of exercise. That would not be moderate for him, except of course if he's a known athlete. But it should definitely not be one that will land you in the hospital. Believe me, I know what I'm talking about, and I'm talking from experience. If you develop symptoms during exercises, including but not limited to the following, you should stop exercising immediately and contact your doctor. Unusual shortness of breath. Yeah, in exercise there could be that feeling of fast breathing and all. But once there's an unusual shortness of breath, you should stop immediately. Tightness in your chest, lightheadedness, dizziness, or confusion. With time, you can progress to higher intensities of exercise, but this should be based on individual exercise tolerance and should be done gradually. Every section of aerobic exercise should include a warm-up and a cool-down. The warm-up period should be a gradual increase in pace and intensity of the exercise. This allows the body to increase blood flow to the muscles and decreases the likelihood of a muscle or joint injury. Your warm-up should last between 5 to 10 minutes, and your cool-down section should last a similar amount of time as the warm-up, with your pace gradually decreasing. The treadmill, I know somebody has been waiting for me to talk about this. The treadmill as an home exercise equipment facilitates aerobic exercise, and most treadmills come with adjustable settings that allow you to customize the intensity of your workout according to your abilities. Hence, it can be moderate. Make sure that you pace yourself on the treadmill so that you don't overeat or get too tired. Another advantage of the treadmill is that they allow you to maintain a steady heart rate throughout the entire exercise. Make sure to warm up before starting your section on the treadmill by walking or jogging for about 5 minutes. If you have any background medical condition of concern, make sure to check with your doctor before starting any new exercise routine. Let your doctor certify that you are fit, as there might be a need to exercise some caution in the choice of your exercise with those conditions. It's also important to dress light, otherwise it would be labor and not exercise. You cannot put on your cocoa cashew or your jean trousers or your fitted dress and say that you are doing aerobic exercise. No, all wrong now. You put on your office outfit, carrying a load and trekking at your normal pace to your workplace, and you're still arguing with your doctor that what you do is more than an exercise. We are not talking about labor here, by the way. We are talking about aerobic or cardio exercise. To make it more enjoyable, I like enjoyment, you can do it with music. You can even get songs or soundtracks with fast beat and try to time your pace with the beat of the music. Trust me, you will find it more enjoyable that way. Lastly, and number 3, for the exercise to really work the way we want it to, it must be regular. It must be regular. Some people now, after watching this video, will start doing the cardio exercise of a thing because of the steroid. Some will even do it way more than the recommendation, but will now stop after a month. No, that's not what we are talking about. In this life, any instruction you leave to chance without definition can be interpreted anyhow. And so, the regularity we are talking about by research has a definition. Number 1, it must be on at least 3 days in the week, which means that it can be more. Generally, we talk about 3 to 5 days of the week. And number 2, it must be for at least 30 minutes on each of these days. 3 days, 3 to 5 days in the week, and for at least 30 minutes on each of these days. Like I said earlier, you can increase on this gradually over time, but those are the minimum. And trust me, I have not been talking from my anus all the while. These submissions are not from an overfed mind. They are research-based and research-proven.
Oh, yes.
And if you understand how research works, they would have gotten some people who did it the right way over a period of time and others who did it the other way, and they would have compared their results and the outcome. There must have been an appreciable or tangible difference in the outcome from the statistics that the research shows before such information or instruction is submitted to the body of knowledge for practice and for advocacy. So this prescription of a cardio or an aerobic exercise that is moderate and regular are research-based and research-proven. If you do this exercise the way it is expected, your heart and your lungs will thank you. Wow. And your body will also thank you. And for those with hypertension, when you combine this exercise that we have described with some adjustment to your diet, summarized by what we call the DASH diet, DASH. I'm going to talk about that some other time. If necessary, if you can then add weight loss, then you can be sure that your BP will be better controlled. In fact, you might not need to start drugs yet if your hypertension is just starting, as these measures may help control your blood pressure for a while before the need for drug eventually becomes obvious. And if you're already on drugs, this lifestyle modification will help reduce the quantity of drugs that you will be needing to control your blood pressure. It will reduce it to the barest minimum. Share this video with anyone you think has a heart or a lung. Kindly like this video if you appreciate what I have talked about. Subscribe to this channel and turn on your notification so as to get prompt hints when I upload a new video. If you have not seen my video series on stomach ulcers, quickly go and do so. And there are about 7 main videos on that. I'll see you in my next video by God's grace. Always bear in mind that your health comes first.